And as we're doing some photos over there, I think the next session is going to talk about frontline workers. So Angela, thank you for the question to set us up for this next session. Perfect. So the theme here is CBOs on the front lines. We didn't plan this. This just happened organically. So how do local CBOs help residents with food, housing, maternal and health needs, and the challenges they face doing this work every day? So help me join and bring up our speakers. We have LaShelle Stewart, Executive Director of Baltimore Healthy Start. We have Heather Chapman, VP and Deputy Chief Impact Officer, United Way of Central Maryland, and of course, Angela Martin, Executive Director, Maryland Community Action Partnership. Welcome.
Good morning, everyone. Really enjoyed hearing the last panel. It is so important to have people in the room making decisions that understand centering the power of those most impacted. So excited to hear that, and we'll continue that theme. So my name is Heather Chapman. I'm with the United Way of Central Maryland, and I serve as our Vice President and Deputy Chief Impact Officer. And so most of my time is really spent toggling between really strategizing the impact that we're going to make alongside stakeholders around the region. So we serve Baltimore City and 5 surrounding jurisdictions, and often partner with others to create impact. And so most of my team is directly in schools or community. And then we have other team members that are working alongside other organizations to create impact. And so we will take a little time before we start for LaShelle and Angela to introduce themselves as well.
All right. Well, thank you, Heather. I'm Angela Martin, the Executive Director of Maryland Community Action Partnership. And what Maryland Community Action Partnership is, it's a network of community action agencies. These agencies provide services to low-income individuals and families. They are the state and federally designated anti-poverty network for the state of Maryland. And so we pretty much run the gamut when it comes to services to reduce barriers to economic stability. Our services include everything from early Head Start, energy assistance, homeless prevention, food insecurity, and an array of services to move families from crisis to thriving. And so with that, we are really the emergency responders when it comes to any kind of social and economic crisis. We're on the ground making sure families are safe and stable. And so that's a little bit about us. It's 17 agencies serving the city of Baltimore as well as every county across the state of Maryland. And we represent Maryland, D.C., and Delaware.
Good morning, everyone. My name is LaShelle Stewart, and I'm the Executive Director of Baltimore. Is it on now? No. Is it on now? Okay. Good morning, everyone. I'm LaShelle Stewart, the Executive Director of Baltimore Healthy Start. We are a community-based nonprofit in Baltimore City. Our mission is to reduce infant and maternal deaths and improve maternal outcomes. We are grassroots. I call us boots on the ground before boots on the ground was a popular song and everything. So we hire from the communities that we serve. Many of our staff actually participated in the program at one point in time. We provide material needs to families. We provide a CRNP who does postpartum visits with families. We have a housing program. We have fatherhood services. We do home visiting with our community health workers. We also have group-based education. We have mental health. We try to cover the gamut of what we think that mothers may need in order to have a safe and healthy pregnancy and make sure that our babies make it safely to their first birthdays and beyond.
Awesome. Thank you, ladies. We're excited to share the stage with you this morning. So off the stage, we also work closely with each of these organizations through at United Way. And so with LaShelle, with Healthy Start, Be More for Healthy Babies, which you'll have heard about already, and we'll hear more about. We are both collaborators and partners in that strategy, and our community action councils are just foundational to much of the work that we do. And so we recently launched a fund with BGE to make sure that we're rolling out energy assistance to a number of residents who were in need of that service. And so our community action agencies were key in getting those funds out to folks on the ground face to face. And so thank you guys for the work that you do every single day. And so my first question with you with that, when we're thinking about alignment, how can Maryland align infrastructure and social supports to improve care and access and economic advancement in both rural and urban areas?
I'll start. It has to be with collective impact, and it has to be authentically including the voice of the community, and not just checking a box, but really, like I said, Baltimore Healthy Start is grassroots. We were boots on the ground. We're actually from the community. So when a lot of healthcare agencies and organizations and stuff now, they need the community voice, but it has to be authentic and engaging people who are actually from that community. And collective impact is also a great model. Speaking of Be More for Healthy Babies, and Baltimore Healthy Start originated a smaller collective impact type model, which is our dyad care, which is mother-baby care, which is in partnership with Total Health Care, which is a federally qualified health center in our area. And so when we talk about collective impact, we're talking about the community being represented by Baltimore Healthy Start, but also the provider being represented by Total Health Care. And with that, it's a win-win situation for the community, for our organization, and also for the healthcare provider, because moms are being seen, babies are being seen. The way we sold it is that it improves the HEDIS scores for the healthcare people. And I know anybody in the room that's in the healthcare field appreciates HEDIS scores improvement, but it was born out of a quality improvement for our moms not going to the hospitals for themselves. And so with this initiative, our moms are seen along with when they take the babies in, because what do moms do? They take the babies for their appointments, but they didn't go back for their own. And so this was a great marriage between the clinic and the community-based organization, because the moms are going back at 2 weeks, at 2 months, at 4 months, at 6 months, at 9 months, and 12 months. When they take the babies in, they're being seen. And we are patrolling for social determinants of health. The clinic is patrolling for health needs. And so everybody wins in that model. So that's one small instance of collective impact that we would like to expand because it works. We've served over 700 people in that model. We've had 700 dyad visits over the course of being implemented since 2021. And so when you talk about using a community-based organization, we have a community health worker that's embedded in the clinic that's also patrolling for those needs, but also helping to meet the needs of the moms that come into the clinic so that they can get their healthcare needs met. And then we talked about Be More for Healthy Babies several times. And so that's a huge collective impact model that's happening in Baltimore City, that's been recognized around the nation, actually around the world, really, where the health department is working with community-based organizations to reduce infant deaths in Baltimore City. And so when we talk about collective impact and including the community, it's not only just including those voices or getting our information, but it's also paying people to participate. Funding is needed when you have a collective impact model, and that we're all equal at the table, and there's no big I's and little U's, but we all are contributing to the process.
Thank you, LaShelle. And Be More for Healthy Babies is an incredible collective impact model, because you see stakeholders from every perspective, really, government and CBOs and residents, just those most, closest to the issues and most impacted. And we see the ROI, right? Like the number of those infant mortality deaths that have decreased.
Yeah, with that collective impact model, it started in 2009. And the infant mortality rate was like 13.6. And so our lowest rate was 2016, when it went down to like 6.9. So, and with collective impact, the infant mortality rate was able to be cut in half. And we see similar things being able to happen with the diet care being implemented so that moms get their needs met along with the babies as well. So collective impact really works when it's genuine and it includes everybody at the table.
Absolutely. With those shared goals, we heard before about the importance of working towards a shared goal and taking each of our piece of the pie. So thank you for that.
And I'll just add to that. I totally agree. Collective impact is the way to go. Having that common agenda, those shared goals, and also those reinforcing activities, right, to follow up and to make sure we have to kind of define what the North Star is for us and what we want to achieve, and then look at strategies to get us there. So when I think about care access, I definitely think about collective impact. And also, making sure that CBOs are at the table when we're talking to corporate entities, when corporate entities and the public sector are talking about social determinants of health or health-related social needs, community-based organizations need to be at the table because we give a on-the-ground perspective of what's happening. And so without that, we're just creating policies and programs, and I'm not sure if they will have an impact. It may not fit the need, right? And so making sure that CBOs are at the table, and also the braiding and blending of federal, state, and local resources. And this is something that we do well within our network as community action agencies. And what this looks like is in Garrett County, for example, it looks like a developer coming with a community-based organization and partnering with the public entity there, the city or the city government, and creating affordable housing, creating senior housing. It looks like even in Delaware, pallet housing for homeless. It looks like the multi-generational facility in Dorchester County that brings seniors together with children in the same facility under the same roof and provides services to multiple generations under one roof. So we know that collective impact work. We know that when we bring these groups together, that we can really address whole health. Because when we talk about healthcare, we've got to look beyond the physical part to the conditions that impact health. And so community-based organizations are working to ensure that those conditions are safe for families. So I'll just add those.
No, that's great, Angela. Thank you for that. So I want to dig a little deeper on the collective impact because we keep hearing that word, right? Collective impact, collective impact. And so really thinking about that, all collaboration, when we say that we are collaborating, it sounds great. We heard about the impact of that with an example like Be More for Healthy Babies, and Angela, some of what you were talking about. But to get to that, it takes work, real work to get there, right? And to make sure that they are authentic and transformational, relationships there. So tell us a little bit about, what it takes to get there, to kind of get in that space, and what are some of the barriers we're seeing to that?
So I'll start. At Healthy Start, we actually have what we call a parent leadership group, where we actually train parents from our organization to tell their stories, to speak. We have a consortium. They're part of the consortium. Some of our parents have gone on to help influence a law in Baltimore City. So it's not just having the community-based organization, but it's also having the people who are served participate in the process, and not just participate where you're taking their information, but as a someone who's getting paid for their work as well, right? When I said there's no little U's and big I's, but actually involving people authentically in the process where they are an equal partner and not just someone that you're taking information from.
Awesome. Angela, anything to add?
Well, I think LaShelle has done a great job of sharing that. It looks a little different in our world
Mhm.
because we're bringing together government entities and for-profit entities that, can do, face that are dealing with an array of issues. So I mentioned housing, um, homelessness, multi-generational. So the partners look different, but the concept of collective impact is the same.
Absolutely. So how, when we talk about that, are there ways that technology and community partnerships extend the reach that we have without increasing cost burden? Is that possible, and what does that look like?
Oh, you want me to start?
I can start. I think when you're bringing technology in, it has to make sense for what we do. It has to be accessible for those who need to use it, and it also has to ease our burden and not make it one extra thing for us to do. For anybody that works at a community-based organization, we have a million things to do. We all wear 100 hats, and so when you get a new grant, it might be a new deliverable, and you might have to do this new thing. But people have to take into consideration, how does that fit into the work and what you're already doing to make things easier and not add another thing to your list of things to do. So I'm not the most tech savvy, and Maxine Reed-Vance is our deputy director. She's in the room as well. So we had the organization, but we're not the most tech savvy, but we welcome technology when it's going to assist us with our work and not have an additional thing to do. And I also like systems. We're part of what's called the 2Gen collaboration as well. And so technology can be used in collective impact models like that to bring organizations together more easily to share information across a platform instead of having to call you up, having to wait for an email, actually having access to what each person is doing with the individual at their organization. So I think technology has its place, but it has to make sense for the community, especially for community-based organizations, but because we're already stretched so thin.
And I'll just add, when it comes to technology, it can make our world more efficient and more effective. And this is an area in which community-based organizations specifically really need to embrace because with all of the new technology, with AI coming into the scene, we have a real opportunity to go beyond access to really align our services and look at the outcomes. I mean, what are we really trying to achieve? We're not just providing services. That's a rotating door. We want to provide results. We want to see people move on the spectrum of crisis to thriving. We want to get them to that place. I shared last night, thriving is different for each person, right? For me, it's a beach home with with a couple of jet skis and not having to work. But and somebody said there's hope, there's the lottery out there. So, but we really want to see families move on this spectrum of economic stability. We want to move them towards that. And so when we think about technology, we've got to really think about infrastructure. How do we really bring health organizations? How do we bring community-based organizations? How do we bring them together with technology to really begin to measure what we do, how we do it, and how effective is it? How do we look at how we measure that effectiveness? And so we have a real opportunity with technology if we embrace it and if we began to work together to really look at what we're doing, how we're doing it, and the effectiveness of it.
I love that. And the 2 points that stuck out to me When you all were talking, LaShelle, your piece around really making sure that we're socializing, if there is new technology that we're implementing, how do we socialize that with those who are doing the work? Because often we just come and say, hey, here's this new, and part of it is infrastructure, right? Because you're running a mile a minute. I've got to move this. I got to keep doing what I'm doing, but making sure that there's time for folks to understand this is how it can benefit you. This is why we're using this. This is what we want to pull from that. So you have really important, I guess, clear data and validated data that's going in. And then how are we not just inputting that, but how are we pulling it out to use it to guide the work that we're doing, and not just using that qualitative piece, but making sure, quantitative piece, but making sure we're pairing it with qualitative. And so we heard the importance of having feedback loops with those who we are working alongside of, who are hopefully also at the table with us. We're not just kind of taking information, but we are feeding information back to folks about this is where we are with the information that you gave us. Because that's one of the issues in community too, is that we often go in, take, but is there a direct connection to the work that we're doing? And so we use the information that you, going back to say, we use this information to do X, Y, and Z, or we couldn't, right? But there's some type of feedback loop and a continuous piece of, as we're doing quality improvement, how are we including those voices in that process in a very meaningful way.
Heather, can I add one more thing
Absolutely.
to that? I want to commend Blooming Health for the technology that they've created to make, services more accessible. I think that's great. Also, what we are seeing here in Maryland as it relates to the One app with DHS. So we're seeing universal application. We're seeing how we're kind of doing the one-stop shop, no wrong door. We're hearing these terminologies and we're seeing this work, but it is all about access, right? And that's as far as it goes. But we've got to truly look at outcomes. It's not just access, right? It's great to make it more accessible, but what are our outcomes and what are we really trying to achieve, as I mentioned before? So there is a real opportunity to look at data, to analyze it, and to really take that data and let it inform how we work.
That's good. That's good. Making sure we're moving the needle, we're getting to the root, and not just band-aiding, right? Yeah, absolutely.
Yeah, and
Go ahead.
one more thing, Heather, I'll just say also that technology makes our services more attractive in this day and age, because our target population is like 24 to 30. Most of those people are into tech and used to like quick turnaround on things that they do. So being able to add the technology piece to the services and the work that we do helps to improve the uptake of what we're trying to provide for families as well.
Absolutely. And making sure we understand, going back to infrastructure, there is an investment in that upfront, right? From staff time to sometimes equipment. Many of us have older computers that sometimes can't handle, what's coming down the pike, and making sure that we have folks when we are having difficulty with implementation to have access to just all of those things, the new processes that have to happen. So really thinking through what needs to happen, but understanding that the reward of that is so awesome. So imagine if all of the information that we held in this room, we had access to around, shared goals, and we're able to, like you said, really look at, where's the process, how we're moving, and then those outcomes to get to that end, and some things may really start to shift. Exactly. Yes, absolutely. So, LaShelle, Baltimore Healthy Start has taken a powerful approach to address infant and maternal health. We just talked about this. What have you learned about how trust and local relationships shape, in a positive way or not so positive way, outcomes, since we're talking about outcomes?
In the positive way, I think I appreciate opportunities where the community voice is actually really being valued and shown value in all ways, by having a seat at the table, by being compensated for what they offer, by being respected for the actual quality that they bring to the process. So I think in that aspect, I appreciate it. On the negative side, oftentimes as a community-based organization, we will originate something, bigger organizations like hospitals, like health departments, like the other governmental agencies will get that information, will amplify that information in a way that they can, and leave the community voice out of it. And so that I do not appreciate, and I fight all the time to keep our voices at the table, because the community has the answers, and like Maxine says, the health is in the community. And so when we're robbed of our information, we're robbed of our solutions, and it's taken, and then we're left out of that. I don't appreciate that. That part, and the trust level there is really tough. So those opportunities where we're authentically, I keep saying authentically being involved, but it really matters to have that community voice for real, like hearing from the people that serve, but also from the people who are on the boots on the ground doing the work. That matters. And when you do the opposite and take our information and take what we've come up with and take it to the next level and not give credence to the people who are in the community working hard to improve health, that's the flip side, and that's the part I don't appreciate.
I appreciate your transparency. That's important, and your advocacy around that. Angela, so much of your work focuses on connecting people to social supports that make so much possible for families, right? And so how do you see access to basic needs and economic stability really impacting and informing mental health and family well-being?
So when I think about basic needs, the lack of basic needs and the lack of economic stability, I'm going to reverse this question a little bit and just have us think about, if you're not able to make if you don't have basic needs and you don't have economic stability, what does that look like for you? Does it affect your mental health? Why, sure it does. It disrupts your life. When we think about the people who have lost jobs, the federal worker who has lost jobs, mental health and well-being is challenged, right? Because it affects not only you financially, it affects your lifestyle, right? No more Pilates classes and gym memberships. We got to think about how we now live and how we, the tough questions. What is most important? So, when we talk about basic needs and talk about economic stability, if there's unmet needs, unmet basic needs, then we're in survival mode. And we see that with SNAP, with the pause with SNAP. What has risen? Shoplifting and theft, because people are in survival mode. If if your food and nutrition is threatened, what do? You look for what you need to survive. And so absolutely it affects mental health. It affects our well-being, because until we can meet the immediate need, our lives are disrupted. We began to have tunnel vision, because this is what we need to survive. So it absolutely does affect, it affects our well-being. And so that's why having access and making it accessible for folks to get services is so important. And we're seeing that right now. This is our world right now. People are looking for services, and as community-based organizations, we're on the front lines. We're there for people, and it's important that they know the services that are provided and where they can go to get those services. So the more we can share and engage with the community at this time, it really helps people stay stable mentally. It really helps them to figure out. We've shifted a little bit from case management to coaching, because we want to walk alongside of people and show them a path that they can take to navigate where they are right now. So absolutely, access is very critical, especially at this time.
Absolutely. And we know that it's important to make sure that we are doing those, holding those downstream services so that we can help to sustain folks while they are engaged and involved with looking at the upstream, right? So we can again get to the root and not just be hamsters on a wheel, just always doing downstream. And so there's a need for both, and a place for both for sure. And so with that, for both of you all, looking ahead, in Maryland, if we could invest in just one thing to strengthen upstream prevention, especially around community health and family stability, what would that look like for each of you? What would you prioritize and why?
Well, I prioritize infrastructure and technology. That would be I mean, that's where we are. We've got to do that. Um, what it looks like to me, and I've been in this work a while now in the social service field, and a lot of us have been, because this is an industry. When you get here, you kind of stay here because it's fulfilling. We love the work of changing lives and helping people. But right now, in this day and age and where we are, we need to really embrace technology to bring healthcare organizations, social services organizations to have a comprehensive type of infrastructure or platform, initiative, whatever it is. I'm thinking a digital platform where we're looking at referrals. We're able to follow up with those referrals. We're able to look at outcomes. We're able to track progress and look at how we measure. And so, and I think we have the opportunity to do that, especially with AI. But there's a platform that is needed that goes beyond access to alignment and really taking into consideration how we work together and what we want to achieve, how we measure that, and really looking at our results.
Thank you, LaShelle.
Well, I think Angela summed it up. But I would also say, yes, on the earlier panel, they talked about, Dr. Jaraza said, and also the guy from Zach from Care First spoke kind of about funding programs for the program. And like Angela said, infrastructure is needed. Community-based organizations operate, and we love the work that we do, but we need operations funding, and we need funds in order to do the work. We need funds in order to, like Angela said, take care of the people who are doing the work. So I would encourage grantors, as they're thinking about making grants, don't only say, well, oh, this money only has to go to programming, because who's going to do the programming and how those people are going to be supported while they're doing the programming. And this is realistic, because we find ourselves, we hire from the community. So many of our staff are pretty much in the same base or maybe a notch above the people that we're serving. And so they need support as well. So when grantors are thinking about giving funds, please, please, please think about those operations so we can have systems that connect care and all those other things as well. And then on a client base, I would say housing. Housing. It's one of Maslow's basic things in the hierarchy of needs. If people don't have safe and affordable homes, they cannot function to do anything else. They can't get a job. They can't go to school. They can't do all those other things if you do not have safe and affordable housing. So in the age where all of the cities are being gentrified and being turned over, we need to think about safe, affordable housing options in cities, not displacing our families out to the suburban areas or out to the rural areas, because then you take away their access to services, to support, and to all those other things that can help them be successful as well. And so I'll get off my soapbox, but yes, support for infrastructure and staff who do the work, and on the family side, safe and affordable housing.
Yeah, I think
I just wanted to say amen.
it's crucially important that we make sure that we are looking at those drivers of health, those social drivers of health, and not in silo, right? Because they all intersect with each other. And so how are we doing that? Looking at the data infrastructure. That's what this panel is about, infrastructure. How do we strengthen that infrastructure of organizations to be able to do the work in a really effective, impactful way? And we can have access to all this data, right? I think about in-house, we staff the 211 call line for our region. Lots of rich data there, but the time we have to actually really look at it and analyze it to see what we need to do, it takes infrastructure to do that.
Yes.
You've got to have the time, you've got to have the space, you've got to have the time to really talk to other partners to see if everybody is bringing a different ingredient. If we're baking a cake, which is the work we're doing, right? If you leave out a couple of those ingredients, you leave out the baking powder, you leave out the flour, what happens to that cake? Right. And so that's what this is, why it's so important for us to be connecting with each other and have the infrastructure to be able to do that, because it takes time, it takes energy, it takes funds. So that's really.
And one more thing, you mentioned breaking down silos, and I will say, I always say that maternal health is not just the responsibility of the Maternal Health Bureau, because everyone else, food and nutrition, HUD, like all of those things work together. So why are we siloing our care? Why are we siloing our resources? Why are we siloing our opportunities? Because it's everybody's responsibility to make sure that we're okay. And so if we improve maternal health, we improve everything else in the community as well. So we all, when we talk about collective impact and we think about it, everything that we each do impacts what happens with the other as well.
Absolutely.
Absolutely.
So I know we are at a point where we're starting to wrap up. Thank you. So I think we have time for maybe one, maybe two questions, depending on if anyone has any questions.
Come on, Sandy.
Thank you. There was a conversation about not being able to bring in the faith community, and you talked about the value of impact and valuing persons that are at the table and being authentic about the people at the table. I've heard from government agencies and from other places, they'll say, the churches are there. Why do they need funds to come to the table? Well, if the churches are using their vehicles to transport folks, I don't know anybody's giving them free gas. And if the churches are using their space for other things, how do you feel about compensating all partners equally at the table?
I am 100% for compensating all partners. A few years back, we had a partnership with Kaiser Permanente where we did barbershops and beauty salons, and we did preventive health in the community through anchoring it at barbershops and beauty salons. So when you talk about the faith community, the community is the answer. So community directives, including the church, things that originate from the community, where the community gathers, should be included at the table, and we all should be paid accordingly for our contributions. And so, yes, I wholeheartedly support that the church should be compensated as well. Yes.
Yeah, and I'll just add to that, because most churches that are able to really come to the table also have a nonprofit arm. So a lot of times they are compensated. It takes all of us. We hear the village analogy, and it's a true analogy. It takes all of us working together to really move people forward. And, when we talk about holistic health and whole health, we're talking about a spiritual component, an emotional, we're talking about physical, we're talking about all of that. So it really takes a group of folks coming together. When it comes to funding, there's just different ways that we're funding, right? So there's federal and state funding. And sometimes I feel like we're all competing against each other. And that's unfortunate, because, it doesn't necessarily allow us to be effective, right? If we're focused on just dollars and who gets to the finish line first with their grant. So, I think there's a better way to think about that. I'm seeing a lot of grants really require that there is more partnership, and that's not a bad thing, that we are partnering together, because it is going to take all of us to really move families forward. And this work is being done, but how effective are we? I think that is the question.
Mhm. I would also encourage us to, as we are thinking about partners that we're bringing to the table, to not sometimes, and it's, we're going a mile a minute, to not assume things. A lot of times, I was just having a conversation yesterday with someone, and there was they were trying to pull someone to the table, and they were not taking advantage of kind of the partnership and the services and all of those things, and they just didn't know. And I said, well, have you talked to them? And so I think a lot of times, again, sometimes it's bandwidth, infrastructure, and things. So and so is not coming to the table. Well, do they know that there's a table to come to, right? Like, have we reached out? Have we had a conversation? Have we found out what the barriers are? Sometimes it's funding, sometimes it's not. Sometimes it's just having bodies to be able to do that work. So there are just having that conversation with folks directly instead of making assumptions to find out, what do you have to offer, right? And putting that together like a puzzle. And what are the barriers? So if there are ways we can reduce those, we can do that. But we appreciate you all. I'm sure our time is up, and excited to hear the rest of the conversation today.